Dr. Layla McCay, who's director of the NHS Confederation, though, still kindly joins me. We've been talking about, obviously, the quarantine and infection rates and the like, but actually one of the real concerns is going to be going forwards is all the other things that can cause us a misery or indeed can kill us. And we've heard again and again of these big issues with people not getting treatment for cancer and for other ailments during the lockdown, and the latest NHS figures have revealed, wow, just how big that wait for a treatment is. Routine operations now, more than 50,000 patients have waited more than a year for those treatments, and we are seeing more and more patients having to wait far longer than they normally would. How soon do you think the government and the NHS can actually get NHS services back to some semblance of normality? Are we going to have to wait until the whole coronavirus pandemic is over to do that?
It's a very difficult question to answer. Everybody is working incredibly hard to bring those services back, and we've been hearing from NHS England and NHS Improvement that the aspiration is to have them back in a very, very rapid way. But what we're hearing from our members, NHS CEOs across the system, is that they're incredibly worried about how quickly they are going to be able to restore all of those services. It turns out to be a bit easier to pause services than it is to restart them in this new COVID scenario, where not only are you having to prepare in case there's more cases, you're having to keep people separate and treat them in different ways in order that they do not get any coronavirus transmission within the hospital. So social distancing, a much longer time to sterilise in between patients, etc., which is leading to fewer patients being able to be treated at any one time. And on top of that, all sorts of other challenges. Lots of members of staff in the NHS, haven't had a holiday for months and months and months. And trying to really bring all those things together means that it's going to be really difficult to get everything back up to speed. But that is in progress, and we are seeing some increase month on month on the amount of services the NHS is able to deliver outside of the COVID-19 response.
Yeah, I mean, there's a lot of people very confused about, why is it so hard to provide other services, given that we haven't got, tens and tens of hundreds of thousands of people in hospital sick with coronavirus. We are down to much smaller numbers, and in many areas there's barely anyone at all on the ventilator. You're still always going to have people who are going to be in these units. Why we cannot be treating more patients, I mean, where especially lots of hospitals are sort of sprawling different blocks, and therefore you could actually separate certain areas from the ICU units where the COVID patients are being treated and keep them safe. Explain to me why it's so hard to get services back up and running.
So these things vary from hospital to hospital. Every setup is different, of course. But I'll give you an example that we keep hearing about from quite a few different CEOs, which is around diagnostic services. So first of all, they can't necessarily bring as many people in to sit in a waiting room at any one time because, they're restricted because of social distancing. Then, when they go in to have their treated their diagnosis, so something like, for example, endoscopy or having a scan, then first of all the machines have to be very much more sterilised. Not just the machines, the entire area has to be sterilised. It takes longer. People have to be wearing more PPE and changing that PPE again. That all takes longer. And then there's other challenges. So, for example, if somebody at the last minute cancels their appointment, as people often do for all sorts of reasons, then in the past people would call the next person in the waiting list and say, we've got a slot, come and fill it. But in many cases, people are still doing self-isolation before their diagnosis.
We're looking at some really basic, simple, practical problems, aren't we, there? Absolutely fascinating. Well, we'll have to leave it there. Thank you so much. Really appreciate you joining us, Dr. Layla McCay, Director at the NHS Confederation.